Hello, my name is Marissa Linger and I'm an MSW student, and I'm going to be speaking with you about autism spectrum disorder. The IDA employs the following definition of autism: a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age 3, that adversely affects educational performance. This definition was found in our textbook, Hardman, Drew, and Egan 2017. There are two primary distinguishing features of ASD: social communication and social interaction, and their restricted repetitive patterns of behavior, interests, or activities. Typical social communication impairments for those with ASD include difficulties with emotional reciprocity, which is the back and forth interaction that takes place in communication and knowing how and when to initiate or respond to others' social interactions. Individuals might struggle with inappropriate turn-talking and may make poor judgments about how much or how little to say, struggle with taking another person's perspective, and could ask inappropriate questions during conversations. Individuals with ASD might have impaired nonverbal communication in which they have difficulty in using and understanding gestures, body language, and facial expression. The text gives an example of misbehaving students and how a teacher might give them the teacher look. The students would respond quickly to this look, while a student with ASD may have difficulty understanding this interpretation of the emotional means of communication. Speech might be impaired with individuals with ASD. The variation of speech abilities in those with ASD ranges from being completely absent to having overly formal speech. Additionally, individuals with ASD tend to take things literally. They may have trouble with metaphor, sarcasm, and figures of speech. Words that depend upon contextual factors for understanding meaning, such as pronouns, jokes, sarcasm, and figurative language, are often too difficult to interpret for them. An example of this can be seen in me telling a student with ASD to break a leg before a musical performance. This student might be confused, wondering why he or she would break a leg. In addition to social communication and social interaction, individuals with ASD exhibit restricted, repetitive patterns of behavior, interests, or activities. Hardman et al. 2017 identified 4 types of patterns: repetitive use of objects, speech, or movements, inflexibility, fixated interest, and sensory sensitivities. Typical motor repetitions include flicking hands in front of their face, flapping hands, rocking, and spinning. These movements can be viewed as stimming or as self-stimulation. Additionally, they may engage in stereotypical or ritualized language where they say the same words or phrases repetitively. They may use objects in stereotypic way, such as spinning objects and playing with objects in an unusual and repetitive manner. An example of this could be a child completing the same puzzle over and over again the same way. The next type of pattern characteristic of those with ASD is inflexibility. Individuals might have an intense insistence on sameness and may become upset if a familiar routine is broken. Those with ASD might have fixations on certain topics, objects, or activities. Furthermore, individuals may experience hyper or hypo-responsivity to particular elements. Hardman et al. 2017 described those that are hypo-responsive as being unresponsive to stimuli such as pain, heat, or cold, and those that are hyper-responsive as having an exaggerated reaction to a stimulus. Here I have outlined a few statistics regarding the prevalence of ASD. 1 out of every 68 children and 1 out of every 42 boys are diagnosed with ASD, according to Hardman et al. 2017. Additionally, students with autism accounted for 10% of students served under IDA in the 2017-2018 school year, according to the National Center for Educational Statistics. And ASD is about 4 times more common among boys than among girls, according to the Centers for Disease Control and Prevention 2019. This could be attributed to gender differences. I've attached a video that will explain how possible gender differences could be camouflaging girls' symptoms, which could make diagnosing more difficult. Additionally, it provides a voice for what it is like to live with autism. So please pause the current video and copy the link to watch what women with autism want you to know. Welcome back. Next, I will be discussing causes of ASD. There is no one cause nor one cure for ASD, according to Hardman et al. 2017. It appears that ASD develops from a combination of genetic and non-genetic or environmental influences. Possible contributors include genetic, infectious, neurological, metabolic, and immunologic factors. Additionally, there is a myth that vaccines cause autism. A lot of media attention has led many to believe that vaccines can cause autism, yet research has shown that there is no relationship between vaccinations and ASD. Identification. Parents ought to become concerned about symptoms of ASD when their child is a toddler. Hardman et al. 2017. Red flags can be seen during their second year of life. Examples of red flags are repetitive mannerisms, not consistently responding to their name, late talking, and regression in developmental milestones. However, sometimes autistic characteristics are categorized as being odd or quirky, especially children with high functioning autism. This can delay evaluation and diagnosing of ASD. ASD diagnosing ranges from an average range of approximately 3 to 10 years. Professionals may use formal screening tools and developmental tests to provide sufficient information for accurate referrals. Assessment/evaluation. I've included a diagram that outlines the steps involved in the assessment and evaluation of a child with ASD. This was taken from IDA Partnerships 2010. After suspecting or detecting red flags, a referral for an evaluation is made. Following the referral, a screening process occurs in which the child's present level of functioning is determined and screening tools are used to screen autism specifically. These screenings will determine if a formal evaluation is needed. During an evaluation, the team will conduct a full evaluation to gather all information needed to inform the eligibility decision-making process. Consent for evaluation must be obtained from a parent or guardian, and this is the start of the 60-day timeline. Educational evaluation addresses two questions. One, is this a child with a disability as defined in IDA? And two, does the disability adversely impact the child's ability to benefit from regular education alone? All information must be brought together and summarized to determine a child's eligibility for educational services, special educational services. Accommodations, modifications, and interventions. Children with ASD who qualify for special education will receive services as determined in their IEP. In their IEP, it contains short and long-term goals that relate to the two primary distinguishing features of ASD. Again, these are social communication and social interaction, and the restricted repetitive patterns of behavior, interests, or activities. Services provided typically include special education, speech, and physical and occupational therapy, according to Hardman et al. 2017. Communication supports are necessary for all individuals on the autism spectrum. Use of alternative communication devices are common because many students with ASD are nonverbal or minimally verbal. All behavior should be seen as an attempt to communicate. It is necessary to identify replacement behaviors when a child is not demonstrating appropriate behavior and to teach a replacement behavior. This is considered positive behavioral intervention and support, PBIS. Visual structure and supports are used to facilitate a predictable environment for students, which can decrease anxiety. An example of this can be seen in creating an individualized schedule for a student, which could be in writing or accompanied with pictures. Again, this decrease their anxiety by allowing them to predict what's going to be going on throughout the day. Accommodations, modifications, and interventions continued. Providing positive and creative educational services. Examples of this can be seen in helping students identify their emotions when they become upset and communicating with specific directions. Psychological and medical interventions. According to Hardman et al. 2017, at least 50% of individuals with ASD receive psychotropic medications during their lives. Generally, medications have been found to treat certain symptoms of ASD, but other methods should be used along with medication. Other evidence-based practices for individuals with ASD include prompting, reinforcement, response interruption/redirection, social narratives, and self-management. Here is a copy of my references that I use to create this presentation.